You know that feeling. You step out of your house, the sky is beautiful, you want to go for a walk. After 2 or 3 minutes, something starts to spread from your lower back down to your glutes, down to your thighs, down to your calves. It is not exactly pain right away. It is a heaviness, a numbness, like both legs are being squeezed tightly from the inside. You have to stop. You lean forward, resting your hands on your knees, and strangely enough, everything eases up. A few seconds later, you can walk again. Then, you stop. Then, you walk again. Then, you stop again. The doctor shows you your scans. They point to the narrow spot on your spinal canal and say, "This is the cause." They hand you painkillers. They might mention surgery. You go home. You are more careful. You walk less. You sit more. And 6 months later, somehow everything is worse, not better. Here is what the doctor does not tell you. The narrow spinal canal on the scan is real. But that is not the reason your condition is getting worse. The real reason lies in the muscles surrounding your spine, and they can absolutely be changed. Today, I am going to show you 4 exercises that target that exact cause. No medication needed, no surgery needed, and you do not need to get down on the floor. Here is what is actually happening inside your body. Known, 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 known. The spinal canal is the bony tunnel that holds your spinal cord and nerve roots. When the canal narrows, the nerves get pinched. That is what you already know. But here is what very few people explain. The actual degree of narrowing changes with every posture you take, and your posture is controlled by your muscles. When your lower spine arches backward, an extended posture, the spinal canal narrows even more. That is why standing straight and walking causes pain. When your spine bends forward, the spinal canal opens up, which is why you feel better when you lean over or push a cart. So what is constantly pulling your lower spine backward? There are 2 culprits. First, the hip flexors become tight and shortened after hours of sitting, pulling the base of your spine forward. Second, your glutes and the deep muscles next to your spine have become weak, and they can no longer hold a neutral posture. Think of a tunnel. The tunnel itself does not shrink, but if there is outside pressure pushing the ceiling and walls inward, the space inside decreases. The imbalanced muscles around your spine are exactly that outside pressure. And that pressure, unlike bone, can absolutely be changed. Now that you understand why, let me show you what you need to do. Today, we have 4 exercises, counting down from 4 to 1. The most important exercise is at the very end, and that is the one that reverses the chain of causes I just explained. You do not need to get down on the floor. All of these can be done on a chair or standing, except for exercise number 1, which can be done lying in bed, and I will give you a chair version if you need it. I also have a bonus exercise at the end, a proper walking technique, specifically for people with spinal stenosis. It is something most doctors do not show you, but it explains why you can walk farther when you are pushing a grocery cart. Exercise number 4, hip flexor, release. Quote, stand behind your chair, holding on lightly with one hand. The hip flexor runs from your lower spine to the front of your thigh. After hours of sitting, it shrinks like a tight string. When you stand up, it pulls the base of your spine forward. Your lower back arches backward, and the spinal canal narrows even more. This is the reason spinal stenosis symptoms are often worse after sitting for a long time and then standing up. Step your right foot back, keeping your heel completely flat on the floor. Keep your hips straight. Do not let them twist to the side. Slowly push your hips forward until you feel a stretch in the front of your thigh and the groin of your back leg. Do not bounce. Do not force it. Just hold still and breathe. With every exhale, the muscle naturally relaxes a little more. Hold for 30 seconds. Switch legs. If you cannot take a long step, just taking a short step and leaning slightly forward is enough. Do this 3 times for each leg, 30 seconds, every single time. This exercise releases the pressure from the front of your spine. The next exercise takes care of the back, and this is the one very few people are taught, but its effects happen almost instantly. Exercise Number 3. Posterior pelvic tilt. Sit right on the edge of your chair. Do not lean back. Keep your feet hip-width apart, with your feet flat on the floor. This is the most direct exercise to open up the spinal canal, not with surgery, but with pure mechanics. When you tilt your pelvis backward, your lower spine goes from an arched posture to a straight posture, and the spinal canal opens up instantly. That is exactly what happens when you lean forward and feel better. This exercise recreates that same mechanism and trains your body to hold that position. Sit up straight and place your hands lightly on your thighs. Slowly tilt your pelvis backward. Imagine you are tucking your tail between your legs. Your lower back moves from a curved outward position to being flat. Hold for 5 seconds. Feel the pressure in your lower back change. Return to the neutral position. Do not arch the other way. That is 1 repetition. Do 15 repetitions for 2 sets. Do this slowly. This is a motor control exercise, not a strength exercise. I want to pause here for a second, because the number I am about to tell you changed the way I have treated spinal stenosis patients for years. In 2015, a study in Japan followed 96 spinal stenosis patients who performed spinal stabilization exercises, including the pelvic tilt, for 8 weeks. 74% reported a significant reduction in pain. No surgical intervention was needed. I have watched patients walk into the clinic hunched over, perform 10 pelvic tilts, and walk out standing taller. Not because their spine changed in 10 minutes, but because the spinal canal was in a more open position for the first time in months. Exercise. Number 2. Seated bird dog. Sit up straight on a chair. Do not lean back. Keep both feet flat on the floor. Running along both sides of your spine is a small group of muscles called the multifidus. It is the deepest muscle, and its job is to hold each vertebra in the correct position during every movement. When this muscle is weak, the vertebrae slip slightly with every step you take and every time you twist, and every single slip puts extra pressure on the nerve roots. Studies show that patients with spinal stenosis have significantly smaller multifidus muscles compared to normal people, and that is one of the best predictors for how fast the disease will progress. This exercise reactivates that exact muscle. Gently pull your belly button inward. Do not hold your breath. Just lightly squeeze your lower abdominal muscles. Slowly straighten your right leg out in front of you until it is parallel to the floor. Keep your back completely still. Do not lean. Do not twist. Hold for 3 seconds. Lower it down slowly. Switch legs. When you get used to it, add raising your left arm up to shoulder height at the same time you extend your right leg. A cross-diagonal pattern, like a bird spreading its wings. If you are able to get down on the floor, get into a 4-point stance on your hands and knees, extend your right leg back and your left arm forward at the same time, and hold for 5 seconds. Do 10 repetitions per side, for 2 sets. Slow and controlled. This is a neuromuscular exercise. Before we get to the most important exercise, if you have been diagnosed with spinal stenosis, and this is the first time hearing someone explain why muscles are more important than bones in this situation, hit that like button right now. That helps other people searching for similar answers find this exact video. Exercise. Number 1. Glute bridges. Lie on your back on a bed or a mat. Bend both knees. Keep your feet flat on the floor, hip-width apart. Rest your arms naturally by your sides. This is the exercise I want you to remember the most after watching this video. The glute is the largest muscle in the body, and it is the direct opposing muscle to the hip flexor. When the glute is weak, the hip flexor has nothing to balance it out. It pulls the lower spine backward with absolutely no resistance. At the same time, your lower back muscles have to overcompensate for every step you take. They overwork, tighten up, and squeeze the spinal canal even more. It is a domino effect. Weak glutes, a tight lower back, and functionally a much narrower spinal canal, and that entire chain can be reversed, starting right here. Before you lift your hips, gently press your lower back flat into the floor using your abdominal muscles. Squeeze your glutes. Feel both sides of your glutes squeezing together. Only then should you push your heels down into the floor. and raise your hips up until your upper body forms a straight line from your shoulders to your knees. Hold for 3 seconds at the top. Your glutes are doing the work, and your lower back is relaxed. Lower down slowly, one vertebra at a time. Do not just drop down. The most important thing here is to squeeze the glutes first and lift the hips second. If you do it the other way around, your back will take over the work, and you will lose the entire benefit of the exercise. Here is the chair version if you cannot get down on the floor. Sit on the edge of your chair and stand up very slowly, just by squeezing your glutes and pushing your heels into the floor. Do not use your hands. Sit back down slowly. That is 1 repetition. Do 12 repetitions for 2 sets. Rest for 20 seconds between sets. One more thing before we finish, and this surprises almost everyone. Do you know why you can walk farther when you are pushing a shopping cart at the grocery store? Most people think it is because the cart is supporting their weight. That is not it. It is because when your hands are holding the cart and pushing it forward, you naturally lean over slightly, and that posture keeps your lower spine in an open position without arching backward. That is the science behind what you have always felt but could never explain. Here are 3 walking adjustments based on that exact same principle. Adjustment 1. Lean slightly forward. Do not hunch over. Just lean your entire body forward about 5 degrees from your ankles. This posture keeps your lower back naturally in a neutral position, avoiding any arching. Adjustment 2. Take shorter steps with a faster cadence. A long step pulls your leg too far back, causing your lower back to arch with every single stride. Shorter steps and a faster rhythm reduce that range of motion. Adjustment 3. Use a cane or handrails if needed. Not because you are weak, but because it automatically creates that slight forward-leaning posture we just talked about. Start with 5 minutes. Stop before the pain appears, not when the pain has already arrived. Increase the time by 1 to 2 minutes every single week. Your body will be able to walk farther, not because your spinal canal has changed, but because you are finally using it the right way. Let's recap. Exercise 4. Hip flexor release. This cuts the pressure from the front of your spine. Do this 3 times for each leg for 30 seconds. Exercise 3. Posterior pelvic tilt. This opens the spinal canal using pure mechanics. That 74% figure is very real. Exercise 2. Seated bird dog. This reactivates the multifidus muscle, the exact muscle that spinal stenosis shrinks first. Exercise 1. Glute bridges. This reverses the domino effect of weak glutes, a tight back, and an increasingly narrow canal. Squeeze your glutes first and lift your hips second. And the bonus exercise. The 3 walking adjustments. Start with 5 minutes and stop before it hurts. Leave a comment right down below. How long ago were you diagnosed with spinal stenosis? And has your doctor given you any exercises yet? I read every single comment. If this video helped you out today, make sure to subscribe to the channel. Every Monday, Wednesday, and Friday, I post a new video built entirely on what I have seen work over 20 years. Move well. Live healthy. I will see you in the next video.